Hi everyone, I'm Gabriel Pereira. I am your host of A Modern Animal. In this podcast, myself and my friend Dr Mike Woodrow will be digging into all things related to the life of a modern animal. Cats, dogs, horses and the occasional fish, we will cover it all, building on Mike's more than 35 years of experience as a veterinary surgeon in Australian country practice, suburban practice, and more recently as the owner of businesses across the pet care space. Hi, and welcome back to this episode of A Modern Animal. I'm Gabe Pereira, my co-host, my partner in crime, Dr. Michael Woodrow. Welcome, Mike.
Good to be here.
And today we have the incredible, someone who puts me to shame and someone who embarrasses me with his intelligence every single time I meet him, Dr. Matthew Mueller. Matt, good morning.
Yeah.
Thank you for that amazing intro. I don't know if it's fully justified, but I'll take it.
And Matt, you're back from an obscenely long holiday, from what I understand. Is that right?
Ish. I mean, that feels like quite a while ago because I've been thrust back into the deep end with the massive backlog in clinic. And but yes, I have been away, which was good to recharge. And back in it, but I had a good break. Yeah, I'd thoroughly recommend.
Okay, so by way of introduction, Dr. Matt Muir, I'm not exaggerating when I say an incredibly intelligent, I'm going to say young man, because I've got 10 years on him, I think, or something like that. A veterinary surgeon by qualification, but has done this incredible body of additional study of his own bat in what we're calling integrative veterinary practice or integrative medicine. Matt, tell us about that process.
Yeah, so I've been a vet for about 11 and a half, 12 years or something at this point. So where it started for me, I think, was actually well before vet school. And actually, when I sort of reflect back on how I ended up being an integrative practitioner, was really my upbringing. And as a kid, I had a lot of pets, and it was the 90s in regional Australia. And at that stage, sort of avoiding the vet at most costs was kind of the culture of the time, and not necessarily wrong. It was kind of from a farming background where people tried to sort things out themselves using home remedies, etc. So across my childhood, I had like a rabbit that got myxomatosis, being told like there's nothing you can do, and being like, really, like that's not really, there's nothing that I can even try. So I guess I had that why not try attitude through my childhood. And I was just borrowing books from the library in primary school. I kind of only thought about this a few years ago, but I was kind of reading books in primary school on pet care and that sort of thing. I was really quite obsessed with pets as a kid. My parents were patient. And looking at species appropriate nutrition and husbandry and learning about husbandry was something that, and I remember that I sort of learned as a kid. And I remember going to the vet with my pets, like my bird or my rabbit. And I remember the vet, Dave Harding, who actually was my first boss and mentor, he would sort of bring out textbooks on birds and rabbits and kind of read me things and like share things, because he didn't profess to know, which I think is incredibly humble and authentic and realistic.
But I see that, and sorry to interrupt you midstream, but I see that reflected in your approach now. So one of the things I've really enjoyed and, to be honest, really loved about our interactions is you've got this massive, a little bit like Mike and I, this massive curiosity. And you don't I've never seen you put yourself forward as, I have all the answers, if you like. It's almost like, cool, this is what the science is saying now. This is what I'm using in practice. These are the results I'm seeing. What do you think? What do you guys see in the human space? What do you guys see in your own, in your product research side of things? So that's one of the attributes of your personality I really enjoy.
Yeah, and it really came from there, but I only realized this in the recent years, this sort of how I ended up being an integrative vet. And so from there, like I went to, and thinking about as a kid, like my grandfather showed me what herbs to forage milk thistle to feed my birds, or he grew herbs in his veggie patch that we fed to my rabbit. And certainly threw raw meaty bones on the lawn for my dog to eat. So I came from that background, and it wasn't, my parents were very open-minded and were like, okay, you have tonsillitis. Why not? I've heard someone say that a chiropractor can help with the structure of your neck. And why not try that? Like, you've had antibiotics as a kid, why not? Let's just try it. Or, during school, to get through the stress of the HSC, my mum was like, why don't we just try rescue? Like, we'll go to someone that does bark flowers and just try it. Like, it might be rubbish, but who cares? Like, it's $20 for a rescue remedy. And if it's placebo, who cares? Like, it's a $10 placebo. And certainly what's cool is the science is now the biomedical paradigm has sort of backed all of this stuff up and realized, okay, traditional medicine, they're onto something. Obviously, like, it's undisputed that most pharmaceutical medicine came from herbal medicine or plants to begin with. And when you look at like Bayesian statistics and things, you can see that there's massive correlations between the pharmacological isolates of that we see coming through the biomedicine with the traditional basis. So I went to Charles Sturt University. I was in the first year ever to go through the program. There was only 45 of us, so we had an amazing and only 1 year, so we had an amazing relationship with the staff members of the program, and we did problem-based learning, and we had a massive focus on production animal medicine. And so when I got through school, like, we had self-directed learning. We could
amazing.
So to me, and it was kind of drilled in, you just need to learn how to problem solve. You just need to learn how to problem solve. That's all you need to learn. You need first principles, and you need to know how to get the information, because you cannot have all of the information. It's evolving at an extraordinary rate. And it's just ridiculous to think that it's possible. So then I had an in production animal focus, so livestock, etc. The first question was, what are they feeding? What's the husbandry been for the livestock? Why are they sick? What pasture have they been on? What weeds have they had access to? Whereas in companion animal medicine, that was really the last question.
Is that so? Okay, so Mike, is that your experience as well?
Yeah, absolutely. And Matt, it's just been so good to hear that introduction. I was looking at our life timelines, and I saw there was about 25 years between when I graduated from veterinary science and when you did. But I see the same themes coming through, which are around curiosity and problem solving. I well remember one of my lecturers saying, we're going to make more mistakes by not seeing than not knowing. And so he was talking about the power of observation and curiosity. And I think you're absolutely right there, that in that production animal, we're dealing much more holistically. We're looking at the whole environment, husbandry, nutrition, physical elements, even quality of the water and those sorts of things. Yep. Whereas in probably in a companion animal setting, it tends to be a much more sterilized setting, and we're often overlooking those things.
Absolutely. And what I've done as a clinical director of a veterinary hospital is I look at our clinical audits and what we do in clinic and zoom out and sort of treat it like herd health and use
interesting.
And so I look at it like the population medicine within the microcosm of our clinic and be looking at the disease rates, zooming out and sort of treating it like I learned, because I started a master's in farm health consulting. I did additional study in sustainable food development. I did a year-long research project two actually year-long research projects. One was a dissertation in the impact of food on the microbiome and subclinical disease in sheep, and then another project for a year in dairy cattle, which is very nutritional driven. Yep. So I sort of zoom out and sort of look at that within my clinic and looking at the populations of animals that
what does that population data kind of epidemiological approach show you? And we are going to get onto topic, by the way, I promise.
Yeah. Well, the topic, I guess, that we're going to talk about today is part of the reason that I see what we're seeing. And I have to preface this with saying that it's early days and this is not clean data, and I'm working to clean up this data. But I'm getting strong positive signals that in our population of animals in our clinic, which is about to turn 18 years old, we rarely diagnose diabetes type 2 and rarely diagnose diabetes type 1. We rarely diagnose blocked urethras in cats. We rarely diagnose cruciate disease.
Right.
It's pretty, we rarely have pancreatitis. We rarely have hemorrhagic gastroenteritis or AHDS now, but HG rolls.
And
off.
Mike, you're smiling and nodding because these are the staples of any modern veterinary clinic, right?
Yeah, well, certainly of the veterinary clinics I was involved in. So
Yeah.
I think Matt's saying is that there's a shift in the trends.
Yeah. And then the other thing that's quite compelling and why I'm just like, because I'm very conscious to try and be scientific about this. People may think someone that's doing integrative medicine, which is kind of Western medicine plus adjunctive, complementary and alternative medicine, other modalities, people might think that I'm not scientific because of that pursuit or that I'm a pseudoscientist. But an inquiring mind and curiosity is actually how innovation happens in medicine.
Totally. And the beautiful thing with animal husbandry or veterinary medicine is, and you guys can correct me if I'm wrong, is it's 0 and 1, right? The animal had this issue, you applied a treatment protocol, the result occurred. There's no mucking around with psychoneuroimmunology or placebo effect or any of that kind of stuff. Is there? Okay, so that's my misconception.
Yeah, I'll come back to that, but remind me to come back to that. That's transference nocebo and transference placebo, and it's quite interesting.
And it occurs in animals as well.
Yeah, like through what's called the psychosocial dyad, like what like levels of
mind blown, Michael Woodrow.
Yeah. Like people that have a more, with all love and respect, neurotic type personality will have potential.
I don't know any of those guys, by the way. So
right, and I'll put my hand up to say that I'm on that spectrum for sure. And that's probably how I end up practicing like preventative medicine, because I'm kind of like, let's avoid all of this drama and have that kind of negative skew that these disease processes are going to happen. However, going back to as a scientist, I'm very aware of confirmation bias, that I'm not pretending that I see what I see. But like the diabetes in dogs example, like the pet census data from like 2013 to 2017, the graph is going like this for diabetes in dogs. And it's bloody easy to diagnose. Like it's not hard to diagnose diabetes.
It's a urinary test, right? So
it's very straightforward. So and we do.
What are you saying? Are you saying because of the practices in your clinic, you're not seeing those disease states show up? Is that what I'm hearing you say?
Yes, and it's an association. I don't know about causation. I don't know if it's that we skew for another type of pet guardian that does other things like exercise enrichment, stress management, etc. I don't know. But what I'm saying is that if someone's like, well, maybe you're not looking for diabetes, it's like, well, no, we are, and we've been doing it for 18 years, and I can't think of I had one scare that I was shocked that it was actually diabetes, but I think the initial screening test was a false positive. But I haven't had one animal in the last 7 years since I've been working there, and I can't find animals there in the last sort of 10 years there. And so that's one example. But the other thing with the confirmation of bias is someone's like, well, you're not looking for it. Well, yes, actually we are.
Yeah. You're doing a standard set of screens, right? And you might have some additional bloods that you get or whatever.
Yeah, I do a lot of functional blood testing and other microbiome testing, sending mostly to the US. But essentially, the other thing that's interesting in our clinic is that as an integrative practice, I'm the clinical director of All Natural Vet Care in Sydney. A lot of people meet us as a secondary or tertiary opinion, and so I'm
going to stop you there. So double click on that. What's going on there? So, and I don't want to put words in your mouth, but this is someone who's got an animal. Maybe the animal's not very well or very unwell, has been to 1 or 2 or 3 different other places. Is that what I'm hearing you say?
Yeah, 4, 5, 6, 7 practices. But yes, so essentially someone might be coming across to us after Googling and finding us in the middle of the night because their pet's been diagnosed with a life-threatening disease like cancer, and they may not be interested in a holistic approach or not really convinced that herbal medicine is good or bad or acupuncture is real or whatever, but they will, out of desperation, come and hear us out at least. And increasingly, everyone's pretty open-minded these days to it because of the influx of the wellness psyche. However, so what I see is I have a clinic where 50% of the animals that visit us have terrible disease diagnosis, terrible chronic health, and 50% come to us when they're young. Often it's because the client that met us in the middle of the night, doom and gloom issue, brings their next pet to us and says, I want to do it different this time. Like, I've learned so much on this journey. I want to do it different. Amazing. Or people nowadays, which is awesome, are just coming to us being like, I want to set my puppy or dog or kitten or other animal up for set up a genuine upstream preventative health medicine program that's tailored to my pet within my means and our lifestyle, and with a degree of pragmatism and based on my philosophy. But essentially what I have is two populations of animals, one that have all of these diseases and one of all these that don't have these diseases. And so I am in a pretty unique position because we get majorly complex comorbidities, like a lot of internal medicine cases, a lot of refractory autoimmune, refractory epilepsy. And if I'm refractory, I guess for listeners, is a disease that doesn't respond to the standard set of treatments.
Got it.
We have a lot of disease, complex disease, life-threatening diseases, major issues, or accumulation and a constellation of issues from a lifetime of chronic
practices or whatever.
And so I can read back through the medical record, which I do, from the scary disease back through their life, and I detect patterns like metronidazole use before 12 months of age, prednisolone before 12 months of age, born by cesarean, didn't get colostrum, persistent papillomatosis, so persistent warts,
weaned too early, et cetera, et cetera.
A whole, so I see that stuff, and it's kind of handy, like with hindsight, to get, okay, this dog's got autoimmune hemolytic anemia, terrible autoimmune disease. But then I can go back and see what's known as the footprints of it nowadays, where you're like, oh, that dog had like really red gums for some unknown reason 2 years ago. No, it was just kind of a furphy. And then, or that puppy got stung by a bee and now they have mast cell tumors, but was it really actually more like the human mast cell activation syndrome?
And a lymph issue or something.
Really don't, or histamine intolerance or dysbiosis. So to me, I've got these two patients running in parallel, and they're running like that. There's not this going on, and this is tens of thousands of patients. And what I'm trying to do now is look at different techniques to actually employ to study this, and discussing it and planning to discuss it more with researchers and pet insurance companies, because we've got quite high penetration rates of insurance in our practice. So we have the liberty, we collect vast amounts of data, and we just need to actually pull insights from it. And I think it's very exciting for that.
It's super exciting. And just, I mean, I'm tooting your horn, but I commend you for taking such a sophisticated approach to it, because it's so, I think, and you're in practice, so, and you've got another business and you're active in different spheres, but to actually take the time to collate the data and study it and try and draw insights out of it to push into clinical practice guidelines, I think is fascinating and so exciting.
Yeah, and there's a lot of other people doing similar things, like the Dog Risk Project in Finland at University of Helsinki. There's the Morris Lifetime Golden Retriever study that ran for 15 years, like a prospective study.
And there's this, is it a Harvard University or Johns Hopkins study going on for longevity in dogs at the moment in the US, I think?
Well, the longevity one that I'm aware of is the Morris Animal, but I don't know if it's a collaboration with those guys, or they're doing it independently. There's probably more. I definitely can't stay across all of the research, but I'm keen to look up whether there's another one. We're kind of looking at starting that in Australia as well. But the cool thing about insurance is people generally don't keep paying insurance once their pet's passed away. So you've got a kind of time stamp where actually the pets probably did unfortunately pass away, and then you have like microchip registration with council, and people don't pre-register years before they get their pet. So you could probably rely on economics to sort of give you more age span data that's more interpretable than previously people. I'm sure, Mike, you've probably seen this phenomenon in clinic where people sort of think that their pets are a bit older than they actually are compared to on what's on your computer system.
Yes.
So so it's exciting times for that. And where the big differentiators, if I think about why I think we see a difference, to me, it's diet. Like that's straight up like the big difference is diet between those two populations of animals. And what I'm inspired by is translational medicine. So looking at what's happening in human medicine, particularly naturopathic medicine.
Yeah. Or functional medicine for that matter. Yep.
Yeah. And I mean, I gravitate more towards a functional practitioner model. But essentially with naturopathic medicine in humans, they don't look at the tools of the trade. So they don't go necessarily, I mean, there's some of this, but looking at like this herb does this, and there's a random clinical trial on this herb.
No.
What the science is more saying is like when you zoom out and it says like, if you go to a naturopath and have an individualized treatment protocol for this disease, that it's effective and safe. Yep. Rather than being like, they will definitely use this herb, this probiotic. And
no, there's a lot more clinical discretion, I think, isn't there, from a prescribing point of view? And I think that's one of the things I think which is interesting about your practice is, and we are going to get on topic, I promise, your application of what one would term both very traditional medicines, the adaptogens, the tonic herbs, the reishis, the withanias, and so on, and your sort of, I guess, particularly from a diagnostic point of view, your fascination and interest in the microbiome. So it's almost you're at two ends of the functional medicine spectrum with respect to animal care.
Well, I think they're the same end because
interesting. Okay.
Most of the adaptogens are prebiotics.
Yes. Yeah.
So
and full of polysaccharides as well, and so on and so forth.
Well, absolutely. So immunomodulation, immunonutrition, the kind of rational use of adaptogens from a Western phytotherapy or Western medicine perspective, and microbiome manipulation to me are the same thing. Particularly when you look at gut-brain axis and stress on the gut, and that to treat the gut and get a diet to produce more GABA. So for people listening, GABA is kind of like Mother Nature's Valium, so an anti-stress medicine that's a neurotransmitter that's produced largely by the gut, similar to serotonin, which other people have probably heard of. Yep. They're looking at how the gut does that using diet and manipulation of the microbiome. It's also, that's like what a lot of the adaptogens do as well. So it's very, very connected in my
opinion. Okay, so with the audience in mind, right? So hello everyone. Our audience, we hope, we assume our audience is, one, not quite as nerdy as we are, but pretty close. Number two, crazy about animals, as the three of us are. What we found people love to hear about is case studies or practical applications of these tools that they can either use in their own practice or go to their veterinarian and have a conversation about. So what I'd ask you to do is give us some examples from your practice or from your own experience, and Mike, jump in as well, of perhaps that very sick dog and the application of adaptogens and or microbiome science, and also, as you said earlier, those incredibly sophisticated pet parents or pet guardians, I love that term, who are preemptively kind of setting the dog up for its quote unquote best life.
Okay, so with case studies, from my perspective,
don't reveal the name of the dog.
No. For Fluffy. So I think it's about just taking it a bit further than, let's talk about, I'm just trying to think about specific patients, but if I can kind of make up a patient that's like a common one that of like a few issues, the story to me may be a 1.5-year-old puppy that comes across for a second opinion, that has had some reflux, some anxiety, some diarrhea with maybe some mucus in their diarrhea, fussiness, an ear infection, starting to get really difficult to give ear medications to, scared of the vet because they've been given an anti-itch injection, had a course of antibiotics for diarrhea that happened around the 4 or 5 month mark, had lots of vaccinations, which I'm not adverse. I'm very much for strategic use of vaccinations at the right time. And so I'll get a second opinion. Someone will come to me for a second opinion, and for itchy skin, let's say. So they come to me at 1.5 years. They've been to, maybe they've been to a specialist because the dog had really bad a vomiting attack on a Saturday night, so needed to go to the specialist, was put on some omeprazole and recommended a barrage of testing for checking swallowing reflex, making sure that there's not a toy stuck in them, something like that. They may or may not have had that testing. They've gone back to their local vet who's been doing a lot of, or their primary care vet that's been doing a lot of the kind of general preventative medicine. They go from being put on a proprietary standard biscuit that the vets sell, which is very scientifically formulated by board certified vets. They get moved to a lower fat diet, or the dog was recommended to have chicken and rice.
Yep. Yeah. So common.
So may have had a 5-day course of steroid medication at some point because the itching was really bad, and the vet was probably wanting to see if it was like responsive to steroids or not. May have had a bee sting when it has big plump Kim Kardashian style lips, and had a shot of dexamethasone, which is a short acting steroid. So that's the puppy that comes to me. So get a puppy, probably a oodle of some description. Probably they don't really know much about the breeder, about where they got it. It may have come home, may have had diarrhea the first week that it came home. So beat the dog for itchy skin. I read back through that medical record and go, oh, what a surprise. Same pattern recognition, and may have seen within one clinic or two clinics, may have seen 6 different vets by this stage because of the nature of business. That they may have just had the next available vet, either out of necessity or that they didn't sort of want or think to have a kind of family GP for the dog that knows the case more robustly. So we have this puppy. They come to me for skin, itchy skin. I'll say, like, start by asking some questions about digestion. And they're like, some people are like, well, I'm here for the skin. I'm like, that's okay. I just want to ask some questions so I can see what I think is going on. Tell me about, remember that your dog needed antibiotics at 4 months. Oh yeah. That, I think they ate something funny. Okay. Yeah. Does your, like, how many bowel motions does your dog do a day? Oh, just the normal amount. Oh, can you actually just, like, what is it, like two a day on average, 3 a day? Oh no, like actually 6 a day. And they're really big. I'm like, does your dog have any wind, like bad smelling winds? Like, and they go, oh, just the usual amount. Oh, well, is that quarterly, monthly, weekly? Oh no, daily is the room. Okay. Does your dog like its food? Not really. Like, it comes and goes, doesn't really eat it, but just the usual amount. Okay, right. Well, my dog's 15 and hasn't refused a meal in 15 years. And he doesn't get that much variety because I give him variety with his mental enrichment. So, okay, so there's a little bit of that. Does your dog eat grass? Yeah, like eats heaps of grass, but that's just to make it vomit. Okay, yep. How often? Weekly. So we'll have this dog at this point, and then I'll meet by the whole, like, COVID pending. By this stage, this is probably 15-minute discussion. And this is allocated an hour, and I've already allocated an hour to read the medical records before. This is, I guess, how we get this depth of knowledge.
Well, this is, as you said earlier, this is functional medicine practice, right? It's not a 15-minute consult.
No, and that's a barrier. Like, that's a barrier for accessibility that I'm trying to solve by getting more.
Yeah, because at the moment, and I'm going to be very blunt about this, integrative medicine is the purview of the wealthy, or the people who are allocating income or the family budget to,
investing, or
it's an investment.
Absolutely, it's a problem, and it's the elephant in the room of like the broken medical system. In my opinion, is that people are just like, I don't actually have the time to discuss.
But it's not that your services and the products you recommend are not worth that time and money. It's just not everyone can afford it.
No, but you always have to look at the opportunity cost of what you're avoiding.
Yes, of course. Of course.
So when
anyway,
I talk,
carry on. Sorry, I interrupted you.
Yeah, when I say we don't see mini cruciates, and we do see some cruciates, and I feel terrible when I have to say to someone, I actually need to have a $7,000 surgery. I feel bad that I've kind of failed them a little bit, that they've needed that. But normally there's generally, I've kind of flagged that it's a possibility.
Yeah.
So we've got this dog, and by this stage, the dog is fiddle clustering, itching in the room. So its behavior is really hyper aroused, kind of nervous, really vigilant to what's going on outside the room, really stressed. And so I see, so this dog to me is a classic, what I call a classic skin, gut, brain axis imbalance disorder dog. A dog that's also got immune system dysregulation, where that its immune system hasn't developed properly. Because at this point,
can I double click on that for a second? So immune challenges, I think that's one area that people in terms of human medicine can self-diagnose, right? Inverted commas. How does one know that your pup or your adult dog is immune compromised?
The whole story that we're seeing at this point. Needing to go to the vet and get reactionary medicine for the first 2 years of their life is immune dysregulation. But itchiness, allergies, like skin allergies.
Because we're not going to see the dog sneezing and coughing and complaining of a sore throat, right? So
they may, but you'll probably get more skin manifestations. But there'll be skin, gut, brain generally. So at that point, I'll say, look, we need to parallel process fixing the gut, the skin, the brain, and we need to prioritize which order. The dog may also be on a tick preventative medication that I say, actually, do you realize that itching or vomiting, chronic diarrhea is seen in something like 4.5 to 8% of dogs that are ever on that, according to the studies that dates, and according to their own drug leaflets. Not to mention FDA alerts and things. Again, I don't think all of those drugs are bad. It's always individualized risk benefit. Because if people say, okay, this drug's a neurotoxin, I'll say, well, also, so is a tick. So we have to mitigate the risks. So anyway, that's the picture of a dog. I will probably say to them at that point, I'm not going to be able to fix you in one visit. If you've come across and you've indicated on I wouldn't say extensive intake forms, but I have more than, I guess, the average. And I'll ask people, do you want me to be your primary care vet? Do you want a one-off second opinion? Do you want shared care, ongoing relationship? Where do you live, etc.? How's this going to work? Do you feel a level of trust with your local vet? Does your dog like going to your local vet? So I'll say, I don't think I'll be able to fix this in one session, but if you only want my opinion is I can't fix it in one session, but you could try X, Y, Z and come back to me if you want, or talk to your local primary care vet about this, or maybe get a third opinion from a specialist or another holistic vet. But I might do something in the first instance. I would say, well, we've got to try and steer the immune system development back on course, because there's a software bug. Because the immune system, like the immune system is there's the hardware, and then you need to upload the apps and upload. Well, the apps are there, but you need to upload all of the information onto the system for the body to navigate what's good and bad with regards to not thinking that chicken is a problem or that dust mites are a problem, but to think that cancer cells are definitely a problem and should neutralize them, and that certain parvovirus is a problem. So your immune system needs to be able to be very discerning. And so when we say immune system dysregulation, we've got thinking that pollen is bad.
So what we're talking about, again, just with the layperson's hat on for a second, it's this, and correct me if my terminology is wrong, the immune system is so hypervigilant that it thinks that everything is a threat to the immune system effectively. So that's when you start to think about the dust and the pollen and everything else, right? Is that fair to say?
Well, it doesn't necessarily think everything's a problem, because you might have a dog that has allergies but also has viral warts in their mouth, or juvenile urinary tract infection, or they get kennel cough, because again, Mike, in our clinic we don't see kennel cough and we rarely vaccinate for it. And also it's very amenable to herbal medicine if they unfortunately do get it. So to me, I use it quite bureaucratically, like if they need to go into boarding or if it's really a high risk patient, and based on informed consent, obviously everything. But to me, so I'll say to them, So yes, the immune system's out, but you got to think that cortisol, like high cortisol, so high stress hormones in the body, will tell the immune system to be on high alert because the environment around them is scary. Very simplistically, it'll potentially damage the lining of the intestine so that the cells that are sitting there in the wall of the intestine sort of grabbing out, it's a tube that goes through the body, and these cells are grabbing out being like, what's that? That's chicken. I'm not really stressed at the moment, so that's fine. Keep going. Pick this up. Oh, that's E. coli. Like, I'm going to mount an immune response to you. You're out. You're not allowed here. Go. Like that's kind of what these dendritic cells are doing. They're like grabbing things and pulling them in, looking at it, going, that's fine. But if the immune system is like, oh, what's going on? Really paranoid, then it's going to be like, oh, I don't know if chicken's a problem. I'm going to mount an immune response. And then the cells potentially get damaged through lack of protein, inflammation, medications that like omeprazole, metronidazole, like two of the common ones that like this dog Fluffy that I'm talking about would have had both of those drugs. And in fact, Texas A&M, who to me are my gurus in gastrointestinal lab work, I use in clinic, use their microbiome test, where they look at the gut balance along this gut wall and in the gut of the good and the bad guys, and the guys that have a tendency to go rogue or go bad, they sort of look at the drug omeprazole, metronidazole as two of the big ones that muck around with this healthy balance, which I'm sure you've seen on TV ads. Everyone's seen TV ads about the pendulum swing of like
good and bad bacteria.
And it is really a bit like that, but it's the trick with integrative medicine, functional medicine, is not to think in black and whites. Like that's where, to me, why I've sort of moved away from like a conventional paradigm of practicing where it's like yes or no. It's always like, well, it depends. There's different colors, etc. But essentially, I'll start saying to people, well, the skin's never going to get better until the gut's better. The gut's never going to get better until the brain is better. And the brain's never going to get better until the gut's sending the right neurotransmitters. And the skin's not going to get better when there's stress, because even like they're all very linked. And it's kind of wider than that with what's known as systems biology. You can throw some liver function in there as well. And to me, liver, microbiome, gut health, when I say gut health, I include liver in that for sure.
So this case study is amazing, and I think you're about to move into treatment phase from where I see you in your conversation. But let's do a couple of definitions before we go there, I guess. So, for the sake of someone who's new to the area, what are adaptogens? How do we classify? What are we talking about when we say the word adaptogens?
Yeah, it's a great segue, because adaptogens, most of them actually have liver protective effects as
right,
and how they work in the liver. How they so essentially. There's many definitions. How I would define it is a compound that, using a variety of different mechanisms around this gut-brain-skin axis, liver axis, hormone axis. Normally what it does is turn down the dial of paranoia in the body and upregulate systems of managing the situation better. So improving resilience to psychological stress, emotional stress, physical stress. And often, so what that normally means is that it makes a dog or a human or other species more adaptable. So if you think about adaptogens, they can be like, okay, I can deal with this. And the body is saying, I can deal with this stressor. And so it pulls back the heightened response of stress, because stress makes the body sick. Through a host of mechanisms. This is very much the field of psychoneuroimmunology.
Well, it's prolonged stress and chronic stress, not hormesis, right?
Yes. So it's not the stress of a dog running in Norway as a sled dog, because they're actually super healthy, but it's sustained stress and potentially a snowball effect of stress, like steroid use externally or increased cortisone will thin the gut lining, which will create more stress physically. So these are compounds that manipulate the hormonal balance that help support the liver, because the liver and the gut microbiomes are dealing with a lot of toxins. And they also, as I alluded to earlier, are generally prebiotics. But a lot of them, when we talk about adaptogens, and we're normally talking about herbs and medicinal fungi, mostly, these strategies generally do a whole plethora of other things at the same time, which is why I love herbal medicine, because if I want a dog that might have some evidence of liver stress on a blood test, which that dog Fluffy may have mild elevations in ALT of maybe 200 or 300, but the vet's like, oh, it's not that bad, or we don't know what it is. We might need to do liver ultrasound.
It's an anomaly. Let's do a liver enzyme test.
Yeah. So then adaptogens to me are compounds that can modulate that hormonal, immunological, inflammatory cascade, and it's pretty complex and pretty deep at how it does it. And really, the other thing that adaptogens do, which I think a lot of people, even within natural medicine, don't really think about, is that it helps protein synthesis in the liver to help stop what are called like catabolic processes. So with stress, you lose muscle health, you lose immune health when you don't have these proteins synthesized. And the other cool thing about adaptogens is they kind of slot into a cycle and generally can do what they need to do without ramping it up.
Totally. And they're non-addictive in most cases, or in fact, in majority of cases, right? They're non-addictive. They're generally non-stimulating in the sense that maybe a cup of coffee might be.
Yeah. I mean, addictiveness. I mean, I think a lot of people probably in the modern world, humans, not necessarily dogs, but a lot of humans probably over-rely on adaptogens rather than actually questioning what their life purpose is or what their work is doing, etc. And also, I'm going to defend coffee because it's a liver detox. I also like coffee. That's one of my secrets.
Same. Guilty.
But for the doggy, adaptogens, I'll be looking at. There's probably kind of about 10 main adaptogens or tonics, and people might recognize different terms with adaptogens. For example, a nerve sedative, someone was really stressed and they will put on sedatives. Well, like withania or ashwagandha, an Ayurvedic herb that I use a lot of. It's one of my favorite herbs, gaining a lot of popularity. A lot of people now know KSM 66.
Absolutely.
So that, to me, if we're looking at, like, it's my sort of probably my number one that I like. What it does, which I like, is it's got evidence in dogs for being liver protectant. It's got a sedative, like it's classified as a sedative. Like its full name is Withania somniferae. So
puts you to sleep.
Like the opposite of insomnia. So it's calming and it helps the body cope. And when you also look at what else it does in like human random clinical trials, it improves like posture. So I should actually fix my posture. Improves posture, reduces ESR, which is a marker in humans about kidney health and general inflammation. It improves growth rates in children and animal studies, but then it doesn't. It turns off those growth rate improvements in adults. It improves, like it has anti-inflammatory effects. It's certainly got chemo preventative effects.
Yeah, it does.
In clinic, to me, if we're looking at genuine preventive medicine, and this is why I say I'm a little bit neurotic, because I think it's kind of the reality to protect against cancer for pets. Like it's, so a lot of people in my clinic will go on to adaptogens with their pets with informed consent, that I'm not guaranteeing that they're not going to get
the studies suggest they're chemoprotective. Yeah.
So that's kind of my definition on a pretty top level for adaptogens.
Yeah, I love it. Okay, so back to Fluffy.
Yes. So Fluffy, I would put Fluffy on a immune modulating some immune modulating herbs that are good for gut and adaptogenic. So I'd be thinking, and potentially to start with, I'd be saying, all right, we need to really, and I always take a multidisciplinary, multimodal approach. So I'd be like, okay, you may need to get a behaviorist involved to help with managing triggers and desensitizing Fluffy to their fear of other dogs or fear of being on a lead or the doorbell ringing. You might need to work, you probably will need to work on that stuff. But in the meantime, what I'm going to do is, so I would say Fluffy's 1 year, 9 months.
Yeah.
Fluffy currently has an ear infection and a skin yeast overgrowth. I can smell it. I don't even need to necessarily do sticky tape prep. Like I don't really need to spend an extra $100 to tell you that there's surface level yeast, because all I'm going to recommend is some gentle therapies, broadly speaking, herbs, nutritional supplements. We're probably going to do a diet change, but also I'm going to recommend a medicated shampoo.
Yep.
So, easy. And with a medicated shampoo, I'll just be like, the side effect profile is unremarkable. So we're just going to start doing that based on the fact that I can smell yeast. I'll explain to them that some people sort of come to me and be like, and I might say your dog needs a course of antibiotics again before we do something, depending on what I'm seeing. If the skin's really bad or there's evidence that there seems to be a marked infection in their intestines, I might be like, we need a couple of weeks of antibiotics, but then we need to rebuild. But generally, I'll try and avoid antibiotics at this point. If they've got active diarrhea, I might put them on a clay-based pre and probiotic just to settle it down. I might be like, just go on a couple of days of a bland diet. So what I want you to do is actually, let's say they're on a commercial low-fat kibble. I'd probably say, well, let's mirror the ratio of fat, protein, carbs, and definitely we'll mirror that. But I'm going to move you on to a whole food version of that.
Got it.
And so instead of using corn gluten and beet pulp as the carbs, I actually want to put you on some carrot mash and some butternut squash mash.
Yep.
And if the diarrhea doesn't stop, let's add a little bit of rice water for starch, and we'll play around with that. I'll then sort of probably put them on a customized herbal tonic, whether it's Chinese herbal formula, if there's enough evidence that something springs to mind, or I might make up a Western liquid tincture or a combination of both. And I have a lot of dual extract powders, lots of different formulations for dogs and cats, because some of them won't eat different things. And some of these dogs...
Will dogs take herbal liquids typically, or cats?
Cats you can't guarantee cats will take anything. Yeah, mostly. And I think if you get it right, if you get the recommendation right, you have better chances. That's that kind of zoo pharmacognosy that animals kind of know what they need. But that doesn't always work, because dogs eat a bunch of chocolate or a bunch of Nurofen.
Or raisins,
So I might put them on. So I'll sort of say to them, we've got the immune system we need to try and get the immune system developing back on track.
Yep.
Your puppy didn't get colostrum from what that you learnt from the breeder. They had a course of metronidazole at 4 months. They've had some steroids. So we think that the gut lining's not great, that they never had the immune information from their mum, and they're on omeprazole now for their gut, for their regurgitation and vomiting, and they're on a diet that's high carbohydrate and in my opinion deficient in omega-3 and deficient in protein to heal the lining of the gut, because of the villi in the gut, like all of these, the wall of the gut needs like good fats and good protein, and your dog's on a low-fat diet that has high omega-6.
It's high carb,
high carb. And we could probably go deeper into problems with high carb, but we won't for this example. So I'd then say, okay, well, let's do, I want you to transition from that diet to this bland diet for 2 weeks. We can't do longer because your puppy it's mostly grown, so we don't have to worry too much about 2 weeks without like
losing condition or
precision of balance of calcium to phosphorus ratios, but we need B vitamins and things coming in. So I might recommend sweet potato or something, and maybe egg for vitamins, etc. So then I'll say, I want to steer your dog's microbiome back on track. I'll have a spiel about the fact that there's no large clinical trials in veterinary medicine to say that this will definitely do that, but this is my approach. Here's I'll put some articles in my care plan for you to read. Nice. And if you're not convinced that you're safe to do it, don't do it.
Yep.
Like, would you like to take some herbs today, or would you like to wait till the plan comes so you can read it and feel comfortable with what you're doing? Because I don't hold guns to people's heads saying you must use holistic medicine for your pet. So at that point, I might be like, okay, well, let's do some pre and probiotics to facilitate a dietary change. Let's do some stress immune modulating herbs. So I'll probably come back, think to put them on something like some reishi mushroom, Ganoderma lucidum, for its ability to work on the T helper cell 1, T helper cell 2, T regulation balance. So balancing that seesaw of like not overreacting to chicken and dust mites, but definitely reacting to viruses and bacteria and cancer cells. So we want to play with that. We want to upload more information onto the system about what is healthy. So I'm actually going to put this dog on another month of colostrum with the assumption that they didn't get it last time, and that there was footprints that they didn't get it from the diseases that they have, that their globulins on a blood test always below normal, and just sort of said, oh, that dog's just got low globulins. But I'll be like, okay, let's just do colostrum because it's very safe, very cheap. Let's just do that for a month. Then I want you to do the mindful, calm eating, like calm your dog down before you eat them. I want you to work with the behaviorist. I'm going to put them on reishi mushroom. I might put them on some nettle leaf as a powder for some antihistaminic effects. I may start building in saying, all right, if we've got to do low fat diet for now, I want to build in some essential fatty acids like fish oil or krill oil or something slowly, because actually those fats have antihistaminic properties, but I would warn people that might take 6 weeks to take effect. I'd maybe do astragalus for immunobalance kind of effect. I'd probably do some milk thistle, which is vets sort of, and it's amazing that how much people use it. And if vets say they don't use herbal medicine, I think they need to remember that they all do milk thistle. And it's just the tip of the iceberg, A, as to that it's not just for the liver, and B, it's just one herb that's part of like about 300 herbs that are amazing for dogs. But essentially milk thistle, I'd use that to help the liver cope with all of the, what I would call allergen inflammatory debris that's floating around the body. And it's an antioxidant because the system is stressed. Antioxidants a bit of a problematic
problem child at the moment.
Medicine, but an electron donor. But again, with I'll make up a formula, and if they have other problems, like they've got some tension in their back, or which often I think is histamine related, I might add some valerian, which is not technically a adaptogen, I wouldn't say. I'd say it's more of a vagal nerve relaxation nerve-line sedative.
But I mean, there's a vagal nerve component to all of the gut disorders that we've just discussed anyway, right?
Absolutely. The vagal nerve is the big connector between gut and brain, organ brain, and it's in both directions, for sure. And that's that's why I talk about mindful eating with dogs, about like don't let them eat when they're in a sympathetic hyper aroused state. They need to be in that kind of rest and digest, calm. The same thing, you just translate what you do for humans. Like, you hear people say, like, don't eat in front of a TV, look at your food,
smell your food, etc.
Because that for a dog, like having them kind of calm, drooling, that's sending the signals to their gut to release the acid so they can actually digest their food properly and get all of the enzymes from the pancreas properly, so you don't get all of these issues of incomplete digestion, protein in the colon, that
multiple stool movements, etc.
And skin problems, like when people say, oh, my dog's on a hypoallergenic diet, I'd be like, well, I think a hypoallergenic diet is a really good quality whole food diet that they can digest normally, and that they don't end up having like rotten protein in their hindgut, in their colon. That's my equine large animal vet coming through in the hindgut, that then promotes all of these inflammatory mediators. And the skin is just the canary in the mine with all of this health. I mean, it's the same as humans. Like, someone's like kind of glowing and has healthy skin, you can be like, okay, they're probably looking after themselves better than the next person. So Fluffy, then I'd say, let's try this. May not work. You may need to come back. I will, by the response to this therapy, I will know how much deeper we need to rehabilitate. And at that first consult, I wouldn't do a microbiome test.
Yep.
I'd just go about. I would make a clinical judgment that the microbiome needs to work. I would say I wouldn't do allergy testing. Okay. I would flag that I'd be like, well, by 2 years, if we're not making progress, we really need to think about whether or not we're going to do further immunotherapy. But right now, I'd explain what I call allergen reactivity, where it's like two people. And I often nowadays talk more in human terms. I mean, I practice in Sydney, and there's a massive wellness culture here. So I often talk to my clients in human terms, and so that I just find it helps with communication. But I'll be like, two people could have an allergy to perennial ryegrass pollens.
Yep.
And you can go watch news in the morning. Not that I think watching news is a great idea at the moment, but you could watch the news in the morning, and they'll tell you the pollen count is 100, whatever. Like, let's say it's 100. It doesn't mean that both those people are going to have a terrible day and need to take antihistamines.
Yeah.
The person with the clean lifestyle that doesn't have liver congestion, or that hasn't been drinking so much, has been eating a more omega-3 rich diet, has been feeding their microbiome using colorful vegetables, hasn't had a stressful week, doesn't have mold growing in their house. Just because the pollen counts are the same doesn't mean that they're both going to express
the same response.
Disease. So I'll say to someone, I'm not going to be able to cure your dog from their tendency to dust mite allergies. However, if we look at just doing a holistic approach to just raise their health and vitality, naturally, we'll probably see some downstream effects for the expression of those allergens. And if we don't, we delve deeper. And that's when, so I may see Fluffy back in, and then, so from that chicken and pumpkin diet, I wouldn't do chicken and white rice because that's too high in glycemic
load.
So
too high GI?
Yeah, glycemic load. Yeah. So then I would say, we need to move you on to a whole food diet that's higher in protein, enriched with natural-based phytochemicals and antioxidants, appropriate levels of fiber, plus or minus. We'll do the colostrum for a month. Let's just do a month of pre and probiotics. We'll do the herbs. They've got prebiotic potential. And for a puppy of that age, we do some stress management. To me, and I've set myself a high bar, it would be a fail for me if they needed to stay on herbs more than 6 months after that point.
Okay.
I'd be trying to get to like just diet.
Yep.
Like
that, which is doable, right? I mean, certainly that seems to be your experience.
Oh yeah. That will work. Like, I mean, a lot of the time you can just go change the diet.
Yeah.
And that's what I used to do, particularly when I worked in the country where people didn't have a lot of medicine. Insurance wasn't a thing when I started. I'd be like, add fish oil, add turmeric, and change the diet, and we'll go from there.
Yeah. So how much of what we've just discussed from a therapy's point of view is covered by pet insurance, if any? It's hard. There's so much discretion with pet insurance. Like with my approach, I think the pet insurance companies know like how science driven we are and what we're using and that what we're not using. And so I think that there's levels of discretion with different classes of insurance and what people like. Some may have a cap of saying they only pay $70 for a consult, and people are spending a couple of $100 on an initial consult based on the time, and their insurance company will only pay for the $70 or whatever. But if someone doesn't get insurance support
in my clinic, like we normally write to the insurance companies and just ask them to review and that we think it's a little bit inappropriate.
That's amazing. So you guys, in that sense, you're way more advanced than, with all due respect to the likes of Bupa and so on, than human insurance. So all natural therapies, with the exception of body therapies and acupuncture, are now out of scope for human insurance, which is, to me as a natural practitioner, just boggles my mind.
Yeah, it's pretty sad. It's pretty sad that you don't really get rewarded for looking after yourself. I mean, there's the problem is they're going to be disrupted by a company. Well, not really a problem for the person, but those companies are going to be disrupted by companies that offer premium discounts on people that demonstrate they have a gene.
Demonstrate longitudinal behaviors that improve health outcomes. Yeah, exactly. Yeah.
Plant-based diet, etc. Yep. So Fluffy may come back to me in 3 months. They may not, and I might say to them, look, this might be a little bit of a roller coaster, but we're going to get onto a complete and balanced diet for their lifestyle, whole food, high omega-3, prebiotic qualities within the diet. We'll try and discontinue the herbs in 3 months, and if things aren't better, we might do some more conventional testing. I might want to get a serum vitamin D3 because low D3 is linked to a lot of allergy and a lot of this gut, brain, skin stuff. May want to look at B12 because they may have burned through a lot of B12 and their guts haven't done it. But a lot of the time, I don't really need to do that stuff.
And I got there just on the basis of that first round protocol.
Yeah, and then so people walk away from that being like, oh, okay, well, I mean, to toot my own horn this time, a lot of people will walk away being like, wow, like I'd never really linked all of that together.
Of course not.
No one's ever really said that like this to me.
No.
And I'll be like, well, that's my lived experience. This is what we see all the time.
Now, so Mike, you've got sorry, Matt, beg your pardon. You've got a hard stop, I think, both of you, haven't you, in terms of the top of the hour?
Probably need to keep moving.
I want to keep going, but I have a sense that we're going to have to call for a round 2, Matt.
Yeah, happy to go again. Yep.
And Matt, I just loved. I've actually been. I feel like I'm in 4th year.
He's got a book of notes. I've been seeing him scribbling away.
Yeah, absolutely. And just one thing though I've been reflecting on is, just as you described Fluffy, I felt that both as a pet owner, like the owner of Fluffy, and also felt it as through the lens of a traditional vet. And what I felt was that like a weight of overwhelming. This problem's never going to go away. Yeah. Both the owner presenting, feeling pretty desperate, and also the vet receiving, going, oh no, not one of these. And I was just thinking the filters and the situations that we experience this through, both as owners and within traditional veterinary practice, is, I've written it down as limitations and narrowness in terms of the time that we've got to attend to it, the options that we've got available, and the consistency of the focus that we're putting to this, trying to resolve that. And I feel for both the owner and perhaps the traditional veterinary practice, where we're really constrained in those areas. And what I heard you showing was, just really opening up in terms of the time that you're giving to it, the consideration, the options that you were bringing to it, and also the holistic, both within the therapies that you're applying, as well as who you might be partnering with to see a resolution, as well as the consistency. So I love it when you say, if we're not seeing a resolution in 2 years, as soon as you introduce that time frame, you think, wow, we're playing a long game here, but it's really worth it. It's absolutely worth it.
So for that clarification, that would be 2 years of age in that instance. But for skin problems, you need to manage people's expectations. And I would say we're not going to probably be able to understand much for skin until we know the whole annual cycle for the pet's allergy triggers. That's the terms we need to think about. We need to be like, you need to be able to brush your pet's teeth by the time they turn 10, not in the next 2 weeks. With the 1-year-old dog. So I hope it resonates with you, Mike, particularly to know what it's like kind of in the trenches in practice. And these are incredibly frustrating diseases, and I still warn people that they're chronic relapsing conditions, but we can just try and invest more upstream. And I think to have more time I guess my shout out with that is when you look at a shift from highly processed feeding to whole food feeding, it allows so much more time for clinicians to delve deeper for the animals that slip through the cracks when you're not bogged down in pancreatitis and other cruciates and all of this, or obesity, diabetes. The amount of time it takes to explain someone how to manage diabetes, you could explain natural feeding to 5 people with the same cognitive energy.
That's big.
Matt, to wrap, give me give the listeners the benefit of that analogy you gave me with respect to the more processed food diets and the sort of the bodybuilding protein analogy.
Oh yeah, so I sort of think with if you're a parent and you go to a pediatrician who's a GP pediatrician, and you know that they haven't studied nutrition, or even if they have, but if they say to you, I want you to go down to your supermarket and pick one protein shake off the shelf, one cereal off the shelf, and I want you to go to the health food aisle and pick up an A to Z multivitamin, and that's all that your kid needs for the next 90 years. There's no evidence that a diet that's whole food based
is any better.
Superiority to that. You only need those 3 foods. It's fine, super convenient, and actually it's better for the planet if you feed these 3 things. And the colorful veggies, there's no science to say that the polyphenols in apples do anything, because I follow this guideline that says you only need these vitamins, minerals, and protein. Doesn't matter where they come from. So we can use just these 3 things. Doesn't matter what cereal you pick, because it doesn't matter if it's corn or wheat. It does the same thing. Feed that to your kid for 90 years. And if you hear people talking about their kids doing better on whole food, it's a load of rubbish. It's a fad. And that's what we've been doing in veterinary medicine since World War II.
Yeah. Isn't that super powerful? I think I shared that with you before.
It absolutely is. And, I think the thing that I'm walking away from this conversation is, times are changing, and just wanted to honor you, Matt, to say it's data that will to help, especially in the clinical sense, that's going to help drive that change. So thanks for the work you're doing.
Yeah, I appreciate it.
Totally agree. Okay, I'm booking you for round 2, both of you guys.
Okay.
I think we didn't get quite all the way down the path that we wanted to today, but yeah, we'll continue the conversation. Thank you so much for your time, Matt.
Great. All right. Thanks, guys.
Thanks, Matt.